Welcome everybody. We're just waiting on a few other to come in from outside for taking photographs. My name is Dr. Grace O'Malley. I'm chair of ASOI and really happy to welcome you all here today. Hands up who's a member of ASOI or was last year. Great, brilliant, and we're looking forward to welcoming all our new members this year again. First things first, for safety, the fire exits at the back of the room and you go out to the main concourse in the event of an emergency. The nearest toilets are if you take a right when you come out of the room. There's free Wi-Fi available, and while tweeting is really valuable in terms of dissemination, it's also sometimes a little bit off-putting for speakers. So if you can find a nice balance between tweeting and engaging and interacting, that would be great. We're really delighted that today we have Minister Marcella Corcoran Kennedy with us, our Minister for Health Promotion. So I'd like to introduce, first of all, Professor Cecily Kelleher. Cecily is the principal of the College of Health Sciences in UCD, and she's also a co-director with the HRB Centre for Diet and Health Research, and she'll be introducing the Minister today. Thank you, Cecily.
Thank you, Grace. It gives me great pleasure to welcome Minister Marcella Corcoran Kennedy to UCD this morning at the opening of this fantastic annual conference for the ASOI, and also to launch the Childhood Obesity Surveillance Initiative report in the Republic of Ireland. This work has been undertaken by the National Nutrition Surveillance Centre at UCD, with findings from 2008, 10, 12 and 15. We're very pleased that the Minister was able to make time to come and visit us in UCD on quite a blowy but pleasant day. And without ado, I'd like to introduce you to the audience. Thank you.
Good morning, everyone. I'm delighted to be here to formally open the Association for the Study of Obesity on the Island of Ireland conference and to launch the Childhood Obesity Surveillance Initiative report. The Healthy Weight for Ireland Obesity Policy and Action Plan 2016 to 2025, which Minister Harris and I launched last year, sets a short-term target for a sustained downward trend in the level of excess weight in children and a reduction in the gap in obesity levels between the highest and the lowest socioeconomic groups by 10%. I'm very pleased that following the publication of the Obesity Action Plan, the Association for Study of Obesity on the Island of Ireland is eager to facilitate addressing the challenge of obesity prevention and treatment in Ireland. Obesity is a complex problem with nutritional, activity-related, psychological, biological and social determinants. Consequently, any realistic solutions must be multifaceted and must be implemented as part of a suite of measures. The theme of the 2017 ASOI Annual Scientific Conference is prevention and treatment of child and adolescent obesity. The meeting aims to identify knowledge gaps concerning obesity prevention and highlight the most contemporary evidence regarding obesity treatment throughout childhood. The 10 steps forward in the Healthy Weight for Ireland Obesity Policy and Action Plan, which I referred to earlier, require actions across multiple sectors. Step 6 specifically calls on the health services to better prevent and address overweight and obesity through effective, community-based health promotion programs, training and skills development through enhanced systems for detection and referrals of overweight and obese patients at primary care level. Other actions include the reformulation of food products to reduce sugar, fat and salt levels, reducing exposure to the marketing and promotion of food high in sugar, fat and salt. Fiscal measures such as the proposed sugar tax and increasing access to free drinking water in schools. In addition, what we do in our homes, our schools, our communities to help build healthy habits for all children and families is vital to our efforts to prevent childhood obesity. These are the critical habits that will help those children who are a healthy weight now stay a healthy weight, and those who are overweight or obese achieve a healthier weight as they grow and develop. And I don't need to tell you that the key healthy habits are to reduce portion sizes, to eat plenty of fruit and vegetables every day, manage street food and not to have them every day, ideally only once or twice a week, replace sugary drinks with water, make being active fun and being active every day, having less screen time and to have more sleep. Many of you will be aware of the Department of Health's Healthy Food for Life campaign, which I launched late last year. 4 of these key healthy habits are important messages in this campaign, and the 23 support materials are available on the healthpromotion.ie website. The campaign involved a number of stakeholders, particularly the HSE, who co-funded the campaign materials. In 2016, the Health and Wellbeing Division of the HSE established the Healthy Eating, Active Living Policy Priority Programme with a remit to mobilise the health services to improve health and well-being by increasing levels of physical activity, healthy diet, healthier weight across service users, staff, the population as a whole, with a particular focus on children and families. And when you consider the large number of people employed by the health service, then of course they're the very good place to start. The programme coordinates and drives the implementation of a series of evidence-based actions across the health services, and with external partners to strengthen capacity to promote healthy weight and prevent childhood obesity. And now moving on to the Childhood Obesity Surveillance Initiative. In 2008, the World Health Organization initiated the Childhood Obesity Surveillance Initiative to provide an ongoing and systematic process for the collection, analysis, interpretation, and dissemination of descriptive information for monitoring obesity in the WHO European region, and for use in programme planning and evaluation. Ireland was one of the 13 countries who participated in the very first round of the initiative. The Department of Health and the Health Service Executive commissioned the National Nutrition Surveillance Centre, UCD, to carry out this work for Ireland. Nutrition surveillance is a core tool to help us monitor progress towards achieving the obesity policy targets. The report published today provides a picture of the height, the weight and the BMI in primary school age children in Ireland currently, as well as trends over time since 2008. It will be repeated at intervals over the lifetime of the policy and will provide valuable information to policymakers and practitioners. Research and monitoring initiatives such as this rely on the consent of children and their parents to provide growth measurements, as well as the individual schools and the Department of Education who facilitate the researchers in collecting the data, and the Department of Health greatly appreciates this. I won't spoil the official presentation, but I do know that the results you will have here today are going to be very encouraging. So it's good to hear that our work together is helping to reduce childhood obesity. So I would like to congratulate the researchers whom I've made earlier and the authors of the report, and the ASOI as organisers of the conference. I wish you 2 really interesting days of discussion. I know you have distinguished speakers, and I look forward to hearing the outcome of the conference and the further actions of the important work on preventing and treating childhood obesity. And I wish you a wonderful couple of days, and thank you very much for the invitation. It's a real pleasure for me to be here to join you this morning. Thank you.